हेलो स्टूडेंट, आज का टॉपिक है कैलेप्स ऑफ लंग्स या एटेलेक्टेक्सिस। तो अब हम बात करेंगे एटेलेक्टेक्सिस या कैलेप्स ऑफ लंग्स। तो सबसे पहले हम बताएंगे कि इसकी डेफिनेशन क्या है। एटेलेक्टेसिस या कैलेप्स ऑफ लंग्स इज डिफाइंड एज द कैलेप्स या क्लोजर ऑफ द लंग्स रिजल्टिंग इन reducing या absence gas exchange. It may affect part या all of one lungs. Atelectasis is the collapse of alveoli या lung tissue. It develops when the alveoli become airless from absorption of their air without replacement of air with breathing. जैसा कि इस स्लाइड में दिखाया गया कि ये जो है एल्वोलाई जो है नॉर्मल है, बट इस केस में कैलेप्स एल्वोलाई जिसकी वजह से गैस एक्सचेंज में प्रॉब्लम होती है। Atelectasis may be acute या chronic. The most commonly described atelectasis is acute atelectasis, which occur frequently in the post-operative setting या in the people who are immobilized and have a slow, monotonous breathing pattern. Etiology of atelectasis या collapse of lung, in which obstruction of airway and diminished distension of alveoli are occur. Next is airway, foreign body, extrinsic compression on airway, enlarged lymph node that compress the airway, masses in the chest that compress the airway या alveoli, cardiomegaly या enlarged pulmonary vessels that compress adjacent airway. Etiology of atelectasis: altered breathing pattern, retained secretion, pain, alternation in small airway function, anesthesia, sedation, increased abdominal pressure, reduced lung volume due to musculoskeletal या neurological disorder, and pain from upper abdominal surgery. Next is restrictive defect and specific surgical process, persistent low lung volumes, secretion or mass obstruction या impeding airway flow and compression of lung tissue, bronchospasm, airway secretion and air inflammation in patient with asthma, abnormal airway secretion in cystic fibrosis. Next is abnormal airway clearance such as with ciliary dykinesis syndrome, airway foreign body, excessive pressure on the lung tissue, and tumor growth within the thorax या elevated diaphragm. Next is the pathophysiology of collapse of lungs या atelectasis, in which reduced alveolar ventilation या any type of blockage impedes the passage of air, trapped alveolar air become absorbed into the bloodstream, but outside air can't replace the absorbed air because of blockage. Isolated portion of lung become airless and the alveoli collapse. Excessive pressure on the lung tissues, restricted normal lung expansion on inspiration, become airless for prolonged period and alveolar collapse. Next is the clinical manifestation, in which cough, sputum production, and low-grade fever occur, marked respiratory distress, dyspnea and tachycardia also occur, trachypnea, pleural pain, and central cyanosis also involved, and difficulty breathing in the supine position and axis. Next is the assessment and diagnostic finding, in which chest X-ray, pulse oximetry, and physical examination also occur. Next is the prevention, frequent turning, early mobilization, strategy to expand the lungs and to manage secretion. Next is the deep breathing maneuver and the use of incentive spirometry या voluntary deep breathing, directed cough suctioning, aerosol nebulizer treatment, followed by chest physical therapy, and the postural drainage and chest percussion या bronchoscopy are involved. Next is the change patient's position frequently, especially from supine to upright position, and promote ventilation and prevent secretion from the accumulating. Next is the encourage early immobilization from bed to chair, followed by early immobilization, and encourage appropriate deep breathing and coughing to mobilize secretions and prevent them from accumulating. Next is the administer prescribe opioids and sedative judiciously to prevent respiratory depression, perform postural drainage and chest precautions if indicated, institute suctioning to remove trachobronchial secretion if indicated. Next is the management. The goal in treating the patient with atelectasis is to improve ventilation and remove secretion, and in the patient who do not respond to first line measure या who can't perform deep breathing exercise, other treatments such as positive expiratory pressure. If the cause of atelectasis is bronchial obstruction from secretion, the secretion must be removed by coughing or suctioning to permit air to re-enter that portion of the lungs. Next is the chest physical therapy and nebulization treatment with bronchodilator. Medication and sodium bicarbonate may be used to assist the patient in the expectoration of secretion. If respiratory care measure fail to remove the obstruction, a bronchoscopy is performed. Endotracheal intubation and mechanical ventilation may be necessary for respiratory failure. Thoracocentesis and removal of fluid by needles, aspiration, or insertion of chest tube because is compression. Next is the bronchoscopy. Next is nursing diagnosis, in which ineffective breathing pattern related to collapse of lung tissue and activity intolerance. Thank you.